Hi, I'm Dr. Blaine Parrott. In my experience, many of my patients will come to my office with spinal arthritis, or osteoarthritis is what it's commonly called. Now there's two major ways that you can actually get osteoarthritis. The most common way is probably being in some kind of accident. Now most people think this is a serious accident, and this does cause it. If you're in a car wreck, or if you were in a horse accident or something unusual like that. What most people don't think about is another way it can happen, which would be trauma, is if you were in school as a child and someone pulls the chair out from underneath you and you sat onto the ground, or you had a small fall where you felt a jolt in your spine. All of these things can actually cause arthritis or osteoarthritis. And osteoarthritis is actually when the spine is wearing out. Now, the reason why it's wearing out is because of the trauma that you had, but the results that you can have is, first off, is pain. You'll notice there's pain, there's stiffness, and you'll notice that your movement is not as good as it used to be. You'll notice that you can't bend like you used to. Now, when you're having these things, it can make it hard to go to work. You notice when you're at work that you just don't work as well as you should be able to, or it's not as comfortable to sit or stand as long as you need to. Or you may find that the pain is distracting. The other thing that can affect is your sleep. At night, you may find when you go down to lay down at night that all you feel is the pain in your back, which makes it so you can't go to sleep. And it can even wake you up at night if the pain's severe enough. The other thing that can happen, and this happens quite frequently with my patients, is they notice they just can't do the things during the day that they like to do. They can even find it restricting to get dressed in the morning or taking a shower. All these things that they can find, and it really affects their life. If you're having any of these experiences, I can help. Give me a call, 530-877-9355. Hi, I'm Dr. Blaine Parrott. And in my experience, when patients have come to my office with arthritis, I have found two very effective therapies to help them get relief from their arthritis. First is a chiropractic adjustment. Second is intersegmental traction. With a chiropractic adjustment, we lightly adjust the spine back into alignment. What this will do is it'll do three things. It'll decrease the pressure on the nerves, it'll decrease the pressure on the discs, and it'll also have less pressure on the joint, which all equal less pain. Second, we will use an intersegmental traction table. An intersegmental traction table, you'll lie down on your back, and as you're lying there, there'll be a set of rollers that gently go up and down your back in this motion. Now with an intersegmental traction, when you're dealing with arthritis, one of the most important things with arthritis is to keep motion in that area. What this will do is lightly introduce motion into each individual joint, which will once again help alleviate the pain. And not only with these two therapies will you get less pain, but you'll get less tension in the area, and you will also notice that you'll have a better range of motion, or you'll be able to move better. People that have had this treatment, or my patients that have had this treatment, they've noticed that they're able to return to work quickly, and they're able to work without pain. Second, they're able to go to bed at night without pain, and they're not woken up during the middle of the night because of discomfort. Third, they're able to return and do the things they like to do, or the things that are necessary, such as putting on their own socks and shoes, or putting on their own shirt, or dressing themselves, or taking a shower. If you're suffering from arthritis, I can help. Call me at 530-877-9355.